parasympathetic and sympathetic innervation of inner organs. Today you answer sympathetic. Next time you will answer parasympathetic and sensory innervation. Some words about parasympathetic. Today you answer sympathetic of nasal cavity. How parasympathetic innervation goes to nasal cavity? We start from what? Yes, nucleus salivatorius superior, preganglionic fibers with nervus. What? Facial nervus facialis, then nervus petrosus major, then ganglion, no, nervus canalis pterygoideae, then ganglion pterygopalatinum. It is interruption, and from ganglion pterygopalatinum, postganglionic fibers goes to rami nasalis posterioris and supplies mucous membrane in nasal cavity. If we speak about parasympathetic innervation of eye, we start from nucleus accessorius, preganglionic fibers with oculomotor nerve, then radix oculomotoria, goes to ganglion ciliare, and postganglionic with nervi ciliaris brevis goes to musculus sphincter pupillae and musculus ciliaris. If we speak about parotid gland, we start from nucleus salivatorius inferior, preganglionic fibers with glossopharyngeal nerve, then tympanic nerve, then lesser petrosal nerve, nervus petrosus minor, goes to ganglion oticum. Postganglionic fibers with nervi auricular, nervus auricular temporalis goes to parotid gland. If we speak about that is on the head, third, seventh, and ninth cranial nerve supplies all organs on the head, parasympathetic innervation. Then vagus supplies all organs on the neck, in thoracic cage, and most organs in abdominal cavity. For example, larynx. We start from nucleus dorsalis nervi vagi, preganglionic fibers with vagus nerve, then nervus laryngeus superior, and nervus laryngeus recurrens, and nervus laryngeus inferior. They goes to plexus laryngeus, and it is ganglion terminale, and from terminal ganglion, postganglionic fibers supplies larynx. If we speak about heart receive preganglionic fibers from nucleus dorsalis nervi vagi, vagus nerve, rami cardiaci cervicalis superior, inferior, and rami cardiaci thoracici, then ganglion terminale and postganglionic fibers through plexus coronarius, dexter and sinister, goes to heart. Liver, nucleus dorsalis nervi vagi, vagus nerve, then plexus esophagealis, then trunci vagalis, anterior and posterior, plexus gastricus posterior, rami celiaci, plexus celiacus, plexus hepaticus, ganglion terminale, and postganglionic fibers supplies liver. And in true pelvis, we start from nucleus intermedio, nucleus parasympathicus sacralis, preganglionic fibers with anterior root, sacral nerves, rami ventralis of sacral nerves, they make sacral plexus, then nervis plantnici pelvini, nervis plantnici sacralis, it is in sympathetic. Now we speak about parasympathetic. From sacral plexus, nervis plantnici pelvini pass through plexus pelvinus, continues to urinary bladder with plexus vesicalis, then ganglion terminale and postganglionic fibers supplies urinary bladder. It is clear. And now we continue to speak about sensory innervation, afferent. For example, from urinary bladder, here it is urinary bladder, that is urinary bladder, and here it is receptors in urinary bladder. And from these receptors, sensory fibers with plexus vesicalis goes to plexus pelvinus, then with nervis plantnici pelvini goes to plexus sacralis, then with sacral nerves goes to posterior root, and here it is first sensory neuron where? In spinal ganglion. Here it is receptors in bladder, plexus vesicalis, then plexus pelvinus, then nervis plantnici pelvini, then plexus sacralis, anterior root, trunk of the spinal nerve, posterior, this is anterior branch, ramus ventralis, trunk of the spinal nerve, posterior root, radix dorsalis, first neuron in spinal ganglion. And if, for example, feeling of pain from urinary bladder, from ganglion spinale, axons goes to nucleus. Who remember which tract conduct feeling of pain to brain cortex? Tractus, not bulba, spina thalamicus lateralis. That is posterior root, spinal ganglion, and here it is spinal nerve. And sensory fibers from spinal nerve goes to posterior root. Here it is first sensory neuron, and from this pseudo-unipolar neuron, axons goes to posterior root. Here it is second neuron, that is nuclei proprii, and axons of this second neuron goes to lateral funiculus, and here it is tractus spina thalamicus lateralis. Then spina thalamicus lateralis here, then lemniscus medialis in pons, lemniscus medialis in midbrain, goes to lateral nuclei of thalamus. Here it is internal capsule and brain cortex, for example, gyrus postcentralis. That is one way for sensory innervation of inner organs. Another way, the same from spinal ganglion, goes to substantia gelatinosa and then goes to tractus spina thalamicus anterior and continues to lemniscus medialis and goes to brain cortex. And last way, through fasciculus gracilis and fasciculus cuneatus, goes to the same nuclei in medulla and then continues to lemniscus medialis and goes to brain cortex. That is why from inner organs we have not got specific tract, but sensory afferent impulses pass together with these tracts, what you already know. All ascending tracts, lateral spinothalamic, anterior spinothalamic, and fasciculus gracilis and cuneatus, and then bulbothalamic tract goes to lateral nuclei of thalamus and goes to brain cortex. Everywhere, in gyrus praecentralis, in gyrus postcentralis, in lobulus parietalis superior, everywhere we have cortical center of interoceptive analyzer. Well, that is why we discuss this way through plexus pelvinus and nervus plantnici pelvini, and then through sacral spinal nerve. Another way, the same from urinary bladder, from all organs in true pelvis. Plexus uterinus, plexus vesicalis goes to plexus pelvinus, and from plexus pelvinus, sensory fibers the same continues into nervi splantnice, help me, nervis splantnice, what? Sacralis. This nervis splantnice sacralis goes to sacral ganglions of sympathetic trunk, then goes to rami interganglionaris, and where is first sensory neuron? In spinal ganglion of upper lumbar segments of the spinal cord. Ganglion spinale in upper lumbar segments. And from this spinal ganglion, next the same through all of these threads. Is it clear? Two ways you should answer for sensory innervation of urinary bladder. One way through plexus vesicalis, plexus pelvinus, nervis plantnicis sacralis, rami interganglionaris, rami communicans albi, and lumbar spinal nerves, and first neuron in spinal ganglion of upper lumbar nerves. And another way, through plexus vesicalis, plexus pelvinus, nervis plantnici pelvini, sacral plexus, sacral spinal nerves, and first neuron in spinal ganglion of sacral spinal nerve. And from spinal ganglion, next this diagram. Substantia gelatinosa, nuclei propria, or nucleus gracilis incuneatus, and so on. Then, abdominal organs, for example, liver, sensory fibers with plexus hepaticus goes to what? Plexus celiacus. And from celiac plexus, sensory fibers, look here in this diagram, with splanchnic nerves, nervus splanchnicus major, nervus splanchnicus minor, and nervus splanchnici lumbalis, goes to ganglions of sympathetic trunk, and then rami communicans albi, thoracic and upper lumbar nerves, and first neuron in spinal ganglion. Here it is. First neuron in spinal ganglion here, and spinal ganglion here, and spinal ganglion here. All of this spinal ganglion, that is first neuron. And from this first neuron, next goes to substantia gelatinosa, nuclei proprii, nucleus gracilis incuneatus. The same about heart. Sensory fibers goes to thoracic ganglion, rami communicans albi, thoracic nerves, and first neuron in spinal ganglion of upper thoracic nerves. Nervus cardiacus cervicalis inferior, and then rami interganglionaris, then rami communicans albi, upper thoracic. It's the same here and here. Everywhere we have sensory fibers, then rami interganglionaris, upper thoracic ganglion, rami communicans albi, and upper thoracic nerve. And then first neuron in upper thoracic nerve. That is first way for sensory innervation in abdominal cavity and in thoracic cage. And another way, together with what? Vagus nerve. Maybe here you have diagram of the vagus nerve? No? There is no? I not draw diagram of the vagus nerve? Well, not a problem. Here it is. Look here. From liver, sensory fibers goes to celiac plexus. Here it is from kidney, from small intestine, from spleen, goes to celiac plexus. From celiac plexus, what? Rami celiaci, plexus gastricus, trunci vagalis, plexus esophagealis, nervus vagus, and where will first neuron for sensory fibers of the vagus nerve? First sensory neuron usually, which ganglion vagus nerve has? Inferior and superior. In most cases it is inferior ganglion. Ganglion inferior of the vagus nerve, and second neuron, that is nucleus. What is the sensory nucleus of the vagus nerve? Solitarius, nucleus solitarius. And now, here it is, vagus nerve, ganglion inferior, and it goes to nucleus solitarius. That is tense cranial nerve, nervus vagus. Nucleus solitarius, it is second neuron, and from nucleus solitarius, axons attached to lemniscus medialis and continues to brain cortex, or thalamus and brain cortex. That is why, if we speak about sensory innervation of heart, rami cardiaci thoracici, ramus cardiacus cervicalis inferior, ramus cardiacus cervicalis superior, then vagus nerve, inferior ganglion, nucleus solitarius, then lemniscus medialis, thalamus and brain cortex. The same about larynx here and here. The same vagus supplies pharynx, rami pharyngi, and another nerve which also supplies pharynx, sensory fibers for pharynx we have from which nerve? Glossopharyngeal. Is it present here, glossopharyngeal? No? No. Well, who have glossopharyngeal nerve? Thank you. From pharynx, rami pharyngi, then nervus glossopharyngeus, and first sensory neuron where? In ganglion inferior or ganglion superior of glossopharyngeal nerve. That is why in this diagram it's maybe first neuron in ganglion superior or inferior of 9th cranial nerve, and second neuron it is also in nucleus solitarius. That is only from pharynx and from tonsils, and carotid sinus, ramus sinus carotids, if you remember. That is sensory innervation through glossopharyngeal and vagus nerve. And last, have you got trigeminal nerve? If we speak about sensory innervation on the head, only through trigeminal nerve. For example, sensory innervation of eye. Which nerves? Nervi ciliaris, what? Longus, and nervi ciliaris brevis. Then nervus nasociliaris, then nervus, what is it? Ophthalmicus, and where is first sensory neuron? In trigeminal ganglion, ganglion trigeminale. And from this sensory neuron, then fibers goes to nucleus spinalis or nucleus spontaneous or nucleus mesencephalicus of trigeminal nerve, and from this nuclei continues to lateral nuclei of thalamus and goes to brain cortex. If we speak about lacrimal gland, sensory fibers with lacrimal nerve, ophthalmic nerve, trigeminal ganglion, sensory nuclei, then lateral nuclei of thalamus and brain cortex. If we speak about parotid gland, nervus auricular temporalis, then nervus mandibularis, first neuron in trigeminal ganglion, and then sensory nuclei of trigeminal nerve, lateral nuclei of thalamus and brain cortex. And here it is, look, that is here it is ophthalmic, maxillary and mandibular nerve, then trigeminal nerve, fifth cranial nerve, first neuron in trigeminal ganglion, second in nucleus spinalis, in nucleus spontaneus, or in nucleus mesencephalicus. And from this nuclei continues to lateral nuclei of thalamus and goes to brain cortex. That is why when next time you will answer sensory innervation of inner organs, on the head only one way through trigeminal nerve. Neck, thoracic cage, abdominal cavity and through pelvis, you should answer two ways. One way through vagus, for example, and through spinal nerves. It is one way through vagus nerve or through parasympathetic nerves in true pelvis. That is one way, here or here, and another way together with sympathetic nerves. Goes to sympathetic trunk, then rami communicans albi, and first neuron in spinal ganglion. And this diagram, that is diagram of interoceptive analyzer. Have you got a textbook? It is first neuron in spinal ganglion, second neuron in substantia gelatinosa or nuclei proprii, and nucleus gracilis and nucleus cuneatus. Next, this sensory neuron, that is sensory ganglion of vagus and glossopharyngeal nerve. Vagus has superior and inferior ganglion, and glossopharyngeal the same, has superior and inferior ganglion. And last, this first neuron in trigeminal ganglion, and from here goes to sensory nuclei of trigeminal nerve. Here it is nucleus spontaneus or nucleus spinalis or nucleus mesencephalicus, and then lateral nuclei of thalamus and brain cortex. This diagram you should answer, and sensory innervation of inner organs. You should answer everything. Parasympathetic, sympathetic today you already answer, and sensory innervation. Parasympathetic and sensory next time I give you written test. And in time of mini exam, after 2 weeks, next week you will answer parasympathetic and sensory, and after next week you will have mini exam in peripheral nerves, cranial nerves and autonomic nervous system. And written part of mini exam, it will diagram of cranial nerves and innervation of inner organs, written test, and oral answer you will answer in spinal nerves on the core. Clear? That is all.